Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स पटना नर्सिंग ऑफिसर एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 101. Which of the following drugs is a proton pump inhibitor? A. Ranitidine. B. Famotidine. C. Pantoprazole. D. Sucralfate. Correct answer C. Pantoprazole. 102. Diabetes insipidus is caused by the deficiency of which of the following hormones? A. Antidiuretic. B. Glucagon. C. Insulin. D. Renin. Correct answer A. Antidiuretic. 103. The name of the surgery in which there is removal of duodenum, head of pancreas, gallbladder and bile ducts is called? A. Appendectomy. B. Lumpectomy. C. Discectomy. D. Pancreatiduodenectomy. Correct answer D. Pancreatiduodenectomy. 104. Bell's palsy is a disorder of the dash cranial nerve. A. 3rd. B. 7th. C. 9th. D. 5th. Correct answer B. 7th. 105. The most common side effect of thrombolytic therapy is A. Metabolic abnormalities. B. Internal bleeding. C. Compartment syndrome. D. Acute renal failure. Correct answer B. Internal bleeding. 106. Which type of solution causes water to shift from the cells into the plasma? A. Alkaline. B. Hypertonic. C. Acidic. D. Hypertonic. Correct answer D. Hypertonic. 107. An individual with which of the following blood groups is a universal donor? A. A negative. B. B positive. C. AB positive. D. O negative. Correct answer D. O negative. 108. The loss of urine resulting from cognitive or environmental factors is the manifestation of A. Overflow incontinence. B. Functional incontinence. C. Urge incontinence. D. Reflex incontinence. Correct answer B. Functional incontinence. 109. While assessing the level of consciousness of a patient using Glasgow Coma scale, which of the following score represents the best motor response from the patient? A. 3. B. 4. C. 5. D. 6. Correct answer D. 6. 110. The loss of ability to recognize objects is called A. Dysarthria. B. Alexia. C. Ataxia. D. Agnosia. Correct answer D. Agnosia. 111. Which of the following is glandular tissue cancer? A. Liposarcoma. B. Adenocarcinoma. C. Neuroblastoma. D. Osteogenic sarcoma. Correct answer B. Adenocarcinoma. 112. The cell-mediated immunity is carried out by A. Red blood cells, B. T lymphocytes, C. B lymphocytes, D. CD4 cells. Correct answer B. T lymphocytes. 113. The lateral S-shaped curvature of the spine is called A. Scoliosis, B. Musculosis, C. Kyphosis, D. Lordosis. Correct answer A. Scoliosis. 114. Dash is a radiological examination using a minimal and safe amount of radiation to allow visualization of breast masses. A. Computed tomography scan, B. Lymphangiogram, C. Angiogram, D. Mammogram. Correct answer D. Mammogram. 115. Barium enema is used mainly for radiological examination of the A. Brain, B. Colon, C. Heart, D. Oral cavity. Correct answer B. Colon. 116. While doing colostomy irrigation, the height of the irrigation bag should be around A. 18 inches, B. 24 inches, C. 12 inches, D. 36 inches. Correct answer A. 18 inches. 117. Which one of the following procedures is used to correct otosclerosis? A. Myringoplasty, B. Myringotomy, C. Mastoidectomy, D. Stapedectomy. Correct answer D. Stapedectomy. 118. The term pyrosis is related to A. Heartburn, B. Pus formation, C. Dysphagia, D. Dyspepsia. Correct answer A. Heartburn. 119. The drugs used to constrict the pupils are A. Mydriatics, B. Sulfonamides, C. Antibiotics, D. Myotics. Correct answer D. Myotics. 120. Which of the following parts of an eye alters the size of the pupil to regulate the amount of light entering the eye? A. Lens, B. Cornea, C. Retina, D. Iris. Correct answer D. Iris. 121. The type of incontinence in which there is constant dribbling of urine and is associated with urinating frequently and in small amount is called A. Overflow incontinence, B. Stress incontinence, C. Functional incontinence, D. Urge incontinence. Correct answer A. Overflow incontinence. 122. Using dark rule of 9, estimated burn size in an adult having burn injury to chest and stomach is dash %. A. 18, B. 27, C. 36, D. 9. Correct answer A. 18. 123. Which among the following is a colloid solution? A. 0.9% normal saline. B. Dextran. C. 0.45% normal saline. D. 25% dextrose. Correct answer B. Dextran. 124. Which of the following results from severe allergic reaction producing overwhelming systemic vasodilation and relative hypovolemia? A. Hypovolemic shock. B. Anaphylactic shock. C. Neurogenic shock. D. Septic shock. Correct answer B. Anaphylactic shock. 125. Which of the following enzymes converts fats into fatty acids and glycerol? 1. Bile. 2. Trypsinogen. 3. Salivary amylase. 4. Lipase. करेक्ट आंसर 4. लिपेस. कैसी लगी यह वीडियो कमेंट करके बताएं. अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना. एंड डोंट फॉरगेट टू सब्सक्राइब. थैंक्स फॉर वॉचिंग. सी यू इन नेक्स्ट वीडियोस.